In this video, I will discuss the best scientifically proven supplements to help with rheumatoid arthritis. As you probably know, so many supplements are on the market and they are advertised to help with arthritis. But are they all working for rheumatoid arthritis? Which of the hundreds arthritis supplements are suitable for people with rheumatoid arthritis? And what is the scientific evidence to support them? Let's dive in.
Rheumatologist OnCall.com.
Hello everyone, I'm Dr. Diana Gurnita and I wanted to thank you for supporting my educational channel. Let me remind you that only in the United States it is estimated that about 1.3 million people carry a diagnosis of rheumatoid arthritis. This is one of the most common forms of inflammatory arthritis that I see in my office. Rheumatoid arthritis, or RA, as we like to abbreviate this, can result in severe damage of the joints if it's not treated appropriately. As many of my patients will ask me, I am sure you also wondered, what supplements can I take to help decrease inflammation? Now let's talk about the first one. Fish oil. You may have heard about the benefits of fish oil in decreasing the risk of heart attacks or strokes. Fish oil supplements contain omega-3 fatty acids like DHA and EPA. How can fish oil decrease inflammation? Polyunsaturated fatty acids like omega-3 can inhibit an enzyme called COX-2, which is the same enzyme that non-steroidal anti-inflammatory medication or NSAIDs can inhibit, and in this way they decrease inflammation. Some studies show that fish oil can decrease the quantity of molecules that produce inflammation, like TNF-alpha or IL-6, which are very well known to produce inflammation in patients with rheumatoid arthritis. Now let me introduce you to some of the other studies on the benefit of fish oil or omega-3 fatty acids done in patients with rheumatoid arthritis. In 2015, a randomized controlled trial involving 139 patients with recent diagnosis of rheumatoid arthritis proved that adding a high dose of fish oil to the triple therapy, methotrexate, sulfasalazine, and hydroxychloroquine, was able to significantly increase the number of patients getting into remission and lower their disease activity. Other studies reveal the beneficial impact of omega-3 polyunsaturated fatty acids on patients' pain, fatigue, morning stiffness duration, and the number of painful and tender joints. Another significant drawback that many patients with rheumatoid arthritis is fatigue. These studies show that adding fish oil to the current medication regimen could be beneficial to decrease fatigue, pain, and morning stiffness. Very important, these studies also shown that adding omega-3 supplementation also reduce the use of NSAIDs. It is also essential to note that no significant side effects were reported in these studies. If you want to learn more, you can watch my video about fish oil in rheumatoid arthritis patients. Now let's move on to the next supplement, vitamin D. Over the last 10 years, researchers discovered that vitamin D is not only a hormone involved in calcium metabolism. Vitamin D was shown to be connected with the immune system. On your immune system cells, there are some receptors for vitamin D that are shown to regulate the function of immune cells and decrease inflammation in your body. In 2022, the VITAL study showed that people with vitamin D deficiency had a 22% increase in the risk of developing an autoimmune disease. Isn't that amazing? Interestingly, there are some studies that show that if you are deficient in vitamin D, your risk to develop rheumatoid arthritis is increased with 65%. That is why in my practice, Rheumatologist OnCall, I check the level of vitamin D for all my patients once a year, and if needed, I do recommend supplementation. But there is an additional reason that I check the vitamin D. Many patients with rheumatoid arthritis are at increased risk for osteoporosis because of ongoing inflammation or because of the use of steroids like prednisone. So if you are deficient in vitamin D, that can contribute to worsening of your bone disease. Did your doctor check the vitamin D level this year? If not, talk to them about that. Next, we will discuss about turmeric. Turmeric is also called the golden spice, and it has an active ingredient called curcumin. For many centuries, this spice has been used in the Asian cuisine for its antioxidants and anti-inflammatory properties. There are over 10,000 studies that have been reported about curcumin biological activities, including more than 120 clinical trials. Initially, animal studies showed that turmeric or curcumin can modulate our immune system cells and decrease inflammation. Now, studies done in people with rheumatoid arthritis also showed that using turmeric for at least 90 days will reduce pain, decrease inflammation markers, and decrease disease activity. Not only that, but using turmeric will decrease the need for other non-steroidal anti-inflammatory medication without any additional side effects. Isn't that amazing? If you want to learn more, watch my video about turmeric in rheumatoid arthritis. Last but definitely not least important are probiotics. First, let me tell you that probiotics are living bacteria that will benefit your gut. In the last century, the bacteria in our gut suffered many changes that are the leading cause of many chronic diseases that we witness today, from diabetes to cancers and autoimmune diseases like rheumatoid arthritis. The gut microbiome was affected by the changes in our diet and the excessive use of antibiotics. Consuming probiotics as foods or as supplements will benefit and restore your good gut bacteria. There are many studies about the importance of the gut microbiota published in the last 10 years. In people with rheumatoid arthritis, gut inflammation and changes in the gut bacteria species might also contribute to the onset of this disease. That is why probiotics were studied in patients with rheumatoid arthritis. Researchers showed that adding probiotic supplements that contain Lactobacillus casei help to reduce the molecules that produce inflammation and result in symptom improvement in patients with rheumatoid arthritis. These patients reported decrease in their pain, decrease in their swelling of their joints, and overall they had improved disease activity. No side effects were reported in patients using a probiotic supplement. Probiotics can also be found in many foods. If you want to learn more about foods that can bring you natural omega-3 fatty acids, vitamin D, and probiotics, let me introduce you to my online course where I will educate you about many supplements that will benefit you. To make it clear, using supplements will not cure the disease, but it has great potential to minimize your symptoms and the need to use more medication to control inflammation. Supplements and an anti-inflammatory nutrient strategies are the best approaches for you if you suffer with rheumatoid arthritis. What supplements did you take? Did they help you? I would like you to leave me a comment below. If you want to learn more, don't forget about giving a like, subscribe to my channel, and press the notification button to inform you about my future videos. Thank you and have a wonderful day.
RheumatologistOnCall.com.